action.
Okay, so here I'm going to show you a stretch that goes by many names. So it's a stretch for the hip flexors. So the hip flexors including the iliopsoas, as well as your rectus femoris, which is one of your quadricep muscles. And many people call this the runner stretch or the couch stretch. It's really just a great way to open up the front of the hip. And you can do this in multiple formats. So we've got a chair here, so a lot of people have a couch that they can do this on very easily. And I like to have a pad underneath my knee if it's on a hard surface like a tile or a wood floor. So when you're in this position, you go down to all fours and then bring your foot up behind you. And make sure that you have something underneath the knee to protect you. Then bring the opposite leg up and then nice and easily come up into this position. Now, when we're in this position, we want to make sure that we're feeling that stretch in the front of the hip. We want to make sure that we're not compromising our low back and getting all of that stretch in the low back area. So if you're getting compression in the low back, then you know you're probably doing it incorrectly. And a quick fix for that is to simply sink your hips backwards. And if we sink our butt more towards our heel, then we may start to feel more of that stretch here in the front of the thigh. And then another really game-changing way to really get the most out of this stretch is actually to do what's called a posterior pelvic tilt. So to take your pelvis and to tilt it backwards. And that really gets more of that iliopsoas and that psoas tendon. So if I'm here, then what I want to do is instead of dumping my pelvis forwards, going here and then tilting the pelvis backwards. A lot of times this can be facilitated by pressing into the ground with the opposite foot. So if I press here, then my hamstrings and my glutes on this side are going to pull my pelvis and pull the bottom of my pelvis forwards, and then the top of my pelvis is going to pull backwards. They're rotating my pelvis posteriorly. And then I should feel an even better stretch here in the front of my thigh and in the front of my hip. You can do this in a couple of different ways. You can just move into that posterior pelvic tilt, or you can hold this stretch for 1 to 2 minutes at a time. And you shouldn't feel any lingering tension or any pain here. And if you are, then you should probably get this checked out by somebody else or like some healthcare provider. And that is the runner stretch.